One of the highlights of my time in Calderdale was being there when our first resident had their COVID vaccine, and since then we've delivered thousands and thousands of vaccines and really weakened the link between high COVID cases and serious illness and death, and saved hundreds of people's lives. I want to thank every single person in Calderdale that has contributed to the delivery of the vaccine programme and given us hope.
I'd like to thank all the volunteers and everyone involved in the COVID vaccination programme in Calderdale. You've all been absolutely fantastic, and your hard work and efforts have ensured the Calderdale COVID vaccination programme has been a real success. Thank you all very much.
As the COVID overall programme manager, I can see the real difference that you have made in terms of the data, seeing that breaking of the link to admissions to hospital, and you have done that. So thank you so much. It's really made a difference.
The VSI Alliance wanted to say thank you.
Thank you.
I'd like to express my personal thanks to all of you who've been involved in the vaccination programme. I've had my own 2 jabs. I went to Spring Hall along with everyone else. It's been a whole team effort, whether you're health professionals or administrators in the background. Thank you. Thank you all of you.
Thank you, NHS.
Thank you, NHS.
We're really grateful to all the primary care staff and volunteers who've been helping with the vaccination drive in Halifax and across Calderdale. It's really helped us get back to work, and our staff are really grateful for all the work that you've been doing. So thank you very much.
I want to say a big thank you to the staff of the vaccination programme who've gone above and beyond. But in particular, I want to shout out to the volunteers in the vaccination programme who have given their time for free.
I'd like to say a massive thank you to all those who have been involved in the COVID vaccination programme. Right from day one, it's been an absolutely monumental effort. During this time, we've had retired colleagues who've come back, we've had people who have done this in amongst their normal line of work, and we've also had volunteers who have given up their time. So thank you to you all.
And I'd like to say a massive thank you to all of you for your time, your dedication and resilience. Thank you.
To everybody who completed a survey, spoke to one of our engagement champions, our COVID champions, or anyone else in your community about your views, because you helped us to get the vaccination programme right and to get vaccines to so many people in Calderdale. Thank you.
Hi everyone, I'm Sue Rosborough, and from July last year, having retired as practice manager of Brigroyd Surgery, I've been involved in managing the COVID Vaccination Inequalities Roving Programme. I'd like to thank everyone who has answered the call to come and work in our clinics all over Calderdale. It didn't seem to matter where we asked you to come. Our wonderful team just turned up. Thank you. I hope you found being involved in the programme rewarding. We have reached thousands of people who, without our programme taking vaccines into the communities, might not have been vaccinated. Feedback from those attending our clinics in the community has been really positive. We have made a difference to people who often think they have been forgotten or are not important. We've been to sixth form colleges, schools for children at risk, mosques, centres which support young families, venues which support homeless people and addicts, centres and hotels for asylum seekers, venues which provide care for patients with serious mental illness. We've taken a bus to Morrison's at Illingworth. We've been to the Acapulco nightclub, and we ran the first vaccine clinic in a circus in the UK, and this received national coverage in the papers and on Channel 4 live from Shibden Park. Thank you once again to everyone involved in this great project. It has been such a success because of you all. Our vaccinators, our admin team, our COVID champions, and anyone who has helped in any way. Thank you so much. Our work with health inequalities across Calderdale continues.
Hi folks, welcome to my kitchen. My name is Lisa Pickles. I'm clinical lead for the Calderdale COVID-19 vaccination programme and member of the Calder and Ryburn PCM Vax team and a GP in Ripponden. I want to thank all of you who have assisted in our huge and successful vaccine campaign in Calderdale. So, in no particular order, thank you to our PCN teams led by the clinical directors, working in partnership with the CCG team, ably led by Kate Horn as vaccination programme lead, and her fab team of can-do people, to name Zoe Potterton, Anna Lendon, Sarah Mackenzie Cooper and Maureen Goddard amongst the many. We've partnered with Catherine Ban and the charity sector, along with the fantastic COVID champions and the RVS, all who have played a huge part in helping our clinics to run smoothly. Not forgetting support from the council, from borrowing furloughed leisure service staff to Debs Harkins and the public health team who offer practical support, funding and guidance across the patch. And huge thanks to our retired GP and nurse colleagues who returned to practice, and currently practicing dentists and optometrists, as well as medical students, all who have given their time freely. And to PGPA for providing them with their contracts and employment support. We've partnered with CHFT matrons and nurses seconded from their day jobs in such as cardiac rehab, TB and flu vaccines. We learnt together on the job. Then there were all of the pop-ups. I was particularly involved with the Peace Hall. Thank you, Nikki, and your amazing team for your support throughout the campaign and for today. Then there was the ACCA. I still have the duty manager in my contacts list on my phone. The circus and Trinity Academy, who even managed to cope with us during an Ofsted inspection. And of course, all the other work at mosques, asylum centres, as well as the unstinting roving inequalities team, ably led by Sue Rosborough. Their work is ongoing. Not forgetting our wonderful pharmacist colleagues, either those working for the PCN teams or community pharmacists. For example, Boots, thanks to Becky and the team for storing our vaccine during town centre pop-ups and for your hard work vaccinating our population. And finally, a big shout out to the Calderdale and Ryburn PCM vaccination team. To name Lucy, Muzz, Claire B, Caitlin and Sue as the vaccination team cabinet, ably led by the fantastic Fawad. Thanks for the fish and chips, pizza and afternoon tea. It's really begun to feel like one big family. Personally, I've made lots of new friends and feel humbled and privileged to have worked with everyone, so thank you to you all. I'm really sorry if I've missed anyone out. We must strive to continue all of the successful partnerships that we've made. What an opportunity we have had and still do. And remember, even though to me this feels a bit reminiscent of an Oscars acceptance speech with all the thank yous and the emotion, Our work has been far more important in view of the numerous lives saved across Calderdale. The Calderdale population, from the elderly and infirm braving early clinics in the snow and ice to the nervous 5 to 11-year-olds we have recently been asked to include, they all owe you a huge debt of gratitude. Every single person involved in this historic programme has been important and played their part with cheer and enthusiasm, which has ensured a great experience for our patients and clients. So, to everyone, I raise my mug of tea to you all and look forward to celebrating with those of you who have been able to attend today. Keep up the amazing work. You are all fantastic. Thank you.
Hi, I'm Kate Horn, COVID Vaccine Programme Manager for Calderdale. I'd like to say a huge thank you to each and every one of you who have played a part in the vaccine programme. I started in the vaccine programme because I wanted to help. I know you started in the vaccine programme because you wanted to help as well. And together we really did help. Together we rolled out the solution to getting out of the pandemic. To each and every one of you that has played your part, thank you. Because without you it wouldn't have been possible. In Calderdale, we've administered around 420,000 vaccines. We've protected 95% of those in the population at the highest risk to the worst outcomes of COVID. And we've vaccinated 61% of 12-year-olds plus. Thank you. Thank you for all your hard work, to each and everybody that has played a part. I thought it was fitting that we filmed it in the Peace Hall today. 1, because we've done many pop-ups here. 2, because it's central to Calderdale. And 3, because we're celebrating here this afternoon. So please remember that we're able to get together because how you have helped. We're able to go about our normal business today because of what you have done. We've still got quite a long way to go, and you know that we are reliant on vaccinations to continue our normal business. But today, please take a little bit of time to celebrate and enjoy what you have achieved. Thank you.
Hi, my name's Dr. Stephen Katzby. I'm a GP in Halifax and Clinical Chair of NHS Calderdale Clinical Commissioning Group. I'd like to give a message of thanks to everybody that's been involved in Calderdale's COVID-19 vaccination programme and has helped in one way or another to deliver over 400,000 doses of the vaccine to the people of Calderdale. These are people that have been working at the hospital, in community pharmacy, in our GP practices in Calderdale, as well as supporters from who've worked up at the pop-up clinics, in schools, in mosques, churches and other community settings. It's been a really united, combined effort, and it's been really important because we've saved lives. And we've enabled Calderdale to come through stronger and more united as a community through the pandemic. Thank you to everybody that's been involved.